So a lot of you will know about therapeutic drug monitoring and how you have to have your drug levels measured, like either when you start on voriconazole or itraconazole, or when you change your dose, or if your doctor thinks, you know, especially with itraconazole, they have to check whether you're absorbing it properly and whether anything needs to be adjusted to make sure enough's getting into your blood and the levels are at the right amount. So it's like the sort of the Goldilocks effect. You don't want too much because it will be toxic, and you don't want too little because then it won't be working. You've got to hit that sort of sweet spot. So it can be quite difficult to predict with especially with the older azoles. It can be a little bit fiddly to predict exactly how much to dose a particular patient with. So say if somebody's maybe got kidney problems, if they're not peeing the amount that people normally do, or if somebody's got liver problems and they're not going to be metabolizing the drug at the normal rate, or if somebody's taking other medications at the same time. So things like, you know, proton pump inhibitors that you get for acid reflux, that can affect how well you absorb antifungals. So when your doctor sort of very blithely just like writes up a prescription for you, they've had to juggle all of these calculations in their head. And it's not all, there can sometimes be things that are not as simple as they first seem. So this is just a case where it was somebody with invasive Aspergillosis, and it was somebody who was very sick already. They were in intensive care, they had a fungal infection, and the doctor just thought, we've got to throw everything at this. So they gave them voriconazole and caspofungin and nebulized amphotericin B, you know, that really went all out. But so they did this therapeutic drug monitoring to check whether the voriconazole that they were putting in this person, whether it was hitting the right levels or not, and it wasn't. And so they gave them more and more and more. I think they gave them 3 loading doses, which is colossal, and also put them on a super high dose. They were giving them 600 milligrams 3 times a day of voriconazole, and they were measuring this person's levels, and they were just really low. So if you have a look at this graph, it looks a bit busy, but basically the 2 dotted red lines, that's the target range that they wanted, and the dotted blue line is what was actually measured in the patient. And they were pouring voriconazole into this poor guy, and there was just none in his blood. And what it turned out was because he was very, very, very ill, he was on a machine called an ECMO, which is extracorporeal membrane oxygenation. So it takes the blood out, puts it through a filter to oxygenate it, and then puts it back into the body, like if your lungs aren't working properly. Yeah, external lungs. Yeah. And what they realised, and you know, they couldn't work out. They even did some biochemical testing, because I thought, has he just got some weird liver and his liver's just munching it up or something? No, it wasn't that either. And what it turned out was this external lungs that they put him on, the tubing for that, and also the membrane inside the oxygenator, the voriconazole was sticking to it. And but again, this is a very cutting edge thing, because I mean, it's quite rare that somebody would be in this situation. But I thought it was really good that the doctors made the effort to publish this, because it's kind of unexplored territory. And if they've got somebody else in future, this is a bit of a little bit of a roadmap of quite how much voriconazole somebody could need. And it just really highlights how useful it is to be able to measure somebody's blood levels and get a quick answer. So like for us, we've got our lab on site, which is fantastic, and they do this test. But if you didn't have a lab nearby that could do this test,
so that might tell us also to be careful about other invasive procedures, like, I don't know, catheterization or PICC line, that type of thing. Wonder how much voriconazole is sticking to those instruments. In as long as it's predictable, it's okay.
Yeah, exactly. Yeah, I think there'd be hardly any surface area on them.
Yeah.
But like obviously because this was like an oxygen transfer thing, it was just a huge surface area. But yeah, all these little adjustments that you need to make, it's so useful having somebody who's already tried it and being able to say, no, you're going to have to put grams and grams.
That's quite interesting because we run ECMO here. It's a specialist technique that only a few hospitals do, and I know we've got an Aspergillosis consultant who works on ECMO, so he must be treating patients for Aspergillosis on ECMO.
Yeah, he does.
So I wonder how, if what he does refers to this work.
Yeah, maybe we'll.
I'm going to have to ask him.
Yeah, you will.
Yeah, and especially with COVID, obviously the number of people in intensive care with a lung infection who are at risk of invasive fungal infections, it's like this perfect storm.
Diabetics on machines.
Yeah, one of the things you have to do dose adjustments sometimes for flucytosine is if somebody's on dialysis.
It's kind of more obvious with dialysis that you're removing things from the blood, but this isn't at all obvious. That's like the research that was done years ago where there was someone in a similar situation in intensive care and they kept getting positive glucose results for him, which indicated he had an Aspergillosis. And I think they must have been treating him, but he wasn't getting any better. And they couldn't figure out why. And it turned out he was drinking ice pops. They were giving him ice pops for his sore throat because he'd been in ICU, and the ice pops were triggering the glucose positive test.
We had another one like that. He was living off porridge and
loads of glucose
or something, and that was increasing it as well.
Well, you can buy beta-D glucan as a supplement now, and so there will be people out there who are taking doses that would come back and get themselves put on voriconazole from that.
That's why we need to know what you're supplementing with.
Exactly, what you're supplementing.
Definitely,
What your diet is.